Oh, maybe I can. Hi, Dr. Bolla. So we are discussing about vaccinations and puppies, kittens, dogs, and cats. Age-wise, mostly age-wise, we go per the age. So I wanted to start with puppies first. So puppies, you can give vaccinations. Puppy 1 starts from 6 to 8 weeks. It depends on the puppy weight. So 6 to 8 weeks of age, they are getting DHPP. That means distemper, hepatitis, parvo, and the parainfluenza comes with the pyrantel, which is a dewormer. That is it for the pup 1. So next, pup 2, anywhere from 8 to 11 weeks or 6 to 9 weeks. It follows every 3 weeks after pup 1. That comes with DHLPP. We are including lepto this time. Distemper, hepatitis, lepto, parvo, parainfluenza. You can also administer another, sometimes it's a core vaccine, but some people call non-core vaccine too, which is Bordetella for the kennel cough at this time, and always comes with a pyrantel. So this visit you have to stretch about heartworm prevention and the flea prevention to the clients. So the pup 3 anytime you can give from 12 to 16 weeks. This is a good time to get their rabies vaccine. So that's why we spread little longer time, 12 to 16 weeks. They are getting DHLPP, distemper, hepatitis, lepto, parvo, parainfluenza, and rabies, and Bordetella booster. So that's it for pup 3 stages. Every time give dewormer, and if they comes in 3 weeks, ask about their heartworm prevention and stuff. So regarding the route, which route do you give? Always subcutaneous. I prefer. Some people do give rabies IM or subcutaneous. That's okay, but make sure pull it back. Make sure that you are not introducing into the vein. Okay. Then the sites, basically I do prefer DHPP goes right shoulder, rabies always right thigh, right rear, I can say, not the thigh, right rear leg. Mostly it's better if you can give below the thigh. Bordetella always intranasal. We have only the intranasal thing unless until the doctor authorized if we get any injections. Again, DHLPP goes right shoulder, rabies right rear, Bordetella intranasally.
So even like the distemper, if it's regular distemper, you wouldn't give it on the right, and then I've heard some doctors say this, and then like the lepto distemper wouldn't go on the left, just both can go on the right.
Because we are combining DH lepto with it, so that's why it's right. If we are giving any ProHeart, anything like that, we can do it on the other side.
The left, okay.
The left side, okay. So that's why it's always better. But if any aggressive pets or anything comes, that's a different story. So that's for the pups. And another thing, I know it's a long discussion, giving vaccines if the pet comes around 12 weeks of age or 16 weeks of age. You have to come to the doctor and ask how many they need to get and what vaccines. If the pet comes around 12 to 16 weeks, I would start with pup 3 so that they can get rabies. So they are on track, then we can go backwards to do a booster vaccination.
So if they are older, would you still say that they need the 3 rounds?
It depends. If it's a puppy is like 4 or 5 months, I do say 2 is okay. But it depends on how much exposure, like a high risk area, they're keeping indoors or something like that. If pets are really in high risk environment, I would say 3. But if it's 6 months, 2 is fine for me. Like a 1 full set and all boosters. DHPP, lepto, Bordetella, everything boosters except rabies vaccine.
Okay, so what if they come past 4 weeks? When is your, when would you
4
say?
4 weeks, 6 to 8 weeks is a good time to give first vaccine. It depends on their weight.
No,
Oh, after 4 weeks pass, it says ideally 2 to 4 weeks to get booster, but 1 week that's okay to give booster.
So like at 5 weeks?
Yeah, 5-6 weeks, yeah.
Okay.
Yeah, but if it's an adult pet, if they get slept or they are coming for 1 more booster if they miss the appointment, but that's okay. They still have a little bit of immunity. but always stress the clients that at least at the most is 4 weeks. So don't stay.
So it's
much
less
longer.
of a chance.
Yeah. And so kittens, it's better in my opinion starting from 8 weeks, because kittens are tiny, always 6 to 8, but the 7 to 8 is a good time to get their kitten one vaccine. It comes with FVRCP, all rhinotracheitis, herpes, I don't say.
You say it wrong.
Right, but yeah, it is without leukemia. You can give that we called feline distemper. So without leukemia, you can give the first time with the dewormer. Always kitten and puppy getting dewormer with their vaccines. And if the kitten is 8 weeks, definitely ask them about Revolution, which is a good choice for the kittens. And they are coming again in 3 to 4 weeks, like a 2 to 4 weeks or 3 to 4 weeks for the second booster. Second boosters should be around 12 weeks or 11 to 12 weeks. We are adding leukemia this time, and feline leukemia plus FVRCP, which is a feline distemper, again deworming. Again in kittens, it depends. Some people do 2 rounds of only 2 for the cats. They don't go for the third set, but for the better safety, it's better doing 3 boosters, like 2 boosters after first vaccine. But cats, it's better 14 to 16 weeks rabies vaccine. So as per the Texas rules, 12 weeks and above. But cats, as I said, always they are kind of tiny, to avoid vaccine reaction. 14 to 16 weeks. Kitten 3, which is leukemia boostering we are this time, feline distemper again, and the rabies. So it comes with the parental. But for all cats or kittens, either Bravecto if they are more than 6 months, or Revolution, always make sure that offer one of either, so that they are getting good protection. So any adult cat comes, again same thing, 1 full vaccine. If they never gotten any leukemia, we always make sure that we are doing triple snap test for kittens or cats. That's the ideal way, doing leukemia before we are administering the vaccine.
Okay. So then
the routes, rabies, same thing, goes right rear, and the distemper with the leukemia, you can give both, either left rear or shoulders on cats. It's better on the left rear, so that they don't feel much, but shoulder is okay. Since they're only getting 2 vaccines. But rabies always right rear, so R and R. So
okay. What would you say before we move on to the adult, or we are technically moving on to the adult, but for puppies, when do you want a heartworm test if they haven't been on prevention compared to when they have?
If they've never been on prevention up to 6 months, I would say just go ahead and do it. It's for the safety, but unless it's better, I would say 6 to 7 months, because I've been seeing in Texas, a lot of mosquitoes. If they've never been on it, that's a good age. If they have been on it, and if they are kind of missing off and on, 9 months is the ideal time. But 6 months, just go ahead and do it. So let them know in 6 more months we are repeating, rather than doing in a year. So 6 months is the ideal time if they've never been on it. Okay. That's my protocol, so that they're gonna get extra protection.
And if they have been on it, say 8 weeks and every single month they were given it.
And the first time we are checking in between 9 to 11 months.
Okay.
So just to make sure that, and ProHeart is good at the time. If they have been on it, Tripart or Trifexis, they are not enough to get ProHeart at that time. Repeat around 9 months. If they are continuously on it, 9 to 11 months is fine. Then go ahead and do either they want the Trifexis or ProHeart is a good idea. So that's working really good.
Okay. And then for adult cat dogs, I know you already went through the routes, but what's their annuals?
Annual vaccines once a year. For once the puppy gets 3 rounds and the kitten gets 3 rounds. So once a year they are getting their all, like a distemper, hepatitis, lepto, paro, parainfluenza, rabies. So Bordetella biannual. You can wait up to a year, but to my knowledge, so pets they are taking for boarding and grooming, so that means they are at high risk. So high risk pets always getting twice biannually, that's a good idea to protect from the flu and body, the kennel cough and all. But up to a year, if like a non-risk, like a not at high risk, they are only staying at home, mom is doing grooming and stuff, but still, my opinion, biannual is very important. Rest of them they can get once a year. So another clinics that I worked before, they can do distemper, hepatitis, parvo, parainfluenza for 3 years, but at least they have to be around 2 years of age, and with all these vaccinations current, then at the second year of vaccine we can make it to 3 more years, either rabies and the distemper parvo. But most of the people are not consistent. That's why I do recommend every year.
Okay, that's good to know. I didn't know that after 2 years.
Yeah, after 2 years.
That's really good to know.
Yeah.
And then for feline?
Yeah, felines also same thing. After 2 years, with all kitten vaccines are on board and they are getting first year annual vaccines, the second year annual vaccine, yes, then we can make it to 3 years.
That's really cool.
Yeah.
What would be the common reactions that you would notice?
Common reactions, the ones that I noticed, like an immediate reaction within 2 to 4 hours after vaccine. Mostly, if it's that's why age and their weight is very important. If they are like small pets getting lepto vaccine, that's the most vaccine. I'm seeing a lot of vaccine reactions of vomiting immediately, getting hives all over the body, mostly eye swelling and the facial swelling, and the hives and the vomiting. Those 3 are common symptoms, and shaking, shivering. So that too you are only noticing within 2 to 4 hours. Some pets do get very delayed vaccine reactions. It would be like a sore at the injection site, but that's about it. If you are noticing any of those, you can do Benadryl. It's milligram per pound. If it's a 25 pounds, go up to 25 milligrams of Benadryl, which is fine. But just watch for symptoms from 2 to 4 hours. After that, localized vaccine reactions of swelling, which would last for a few weeks in some pets, but that can be resolvable.
Okay. I had another question, but can't remember what it was. When it comes to having a vaccine reaction and they bring the pet back in, it's important to mark that on the file too, correct?
Yes, it's always better on the one of our once we open the client file, how we can see the caution or something like that. It's always better if you have time. Always ask the clients if a small Maltese or Chihuahua or any small breeds, even big breeds too, but mostly small breeds, I see a lot of vaccine reactions. Ask them, hey, your pet has any vaccine reaction before, If they say yes, either they have to administer, we have to do direct injection, or the clients has to do oral Benadryl at home before they are coming to their appointment for the vaccine.
Since we're trying to move back to our check-in kiosk, it'll actually have that as a question. So do we have any vaccine reactions? Are we pregnant or unwell? Anything like that. So that'll help a lot.
Always ask, and if a geriatric pet, I would say like around 12 to 14, more than 12-year-old pet comes, if you are discussing about the vaccines, always come to the doctor, ask the doctor. And before you are administering lepto, that's the only one that is kind of giving reaction. And that old pets, just always ask the doctor. If pet is always getting it and only stays outdoors, I can go ahead and do it. But always come to the doctor and ask if you think the pet is not good as per you. Okay.
Do you have anything else you think you should add?
That is it, but always tell owners, even though if you don't have time, the only things that they are worrying, we are getting calls about vaccine reactions, and hey, my pet has swelling, just let them know, hey, that's normal, just watch it. If it gets any bigger, they can always come by just to to see you guys. But as I said, 12 to 16 weeks is a good time to do rabies. As per the Texas, that's if owner declines any vaccines, rabies is very important as per the rule, as per the law. So you can administer rabies that day and they can come back to think about the vaccine. So vaccines are very important to protect their lives. So yeah.
All right, thank you, Dr. Bolla.